So just, I guess, to give a quick overview of what I'll just discuss in the next 8 minutes, and I will try and keep within time, is I will respond with just some reflections to the questions that have been posed to this panel. Firstly, looking at the year of constant change, where are we now? And I'm going to speak to the human rights side of that and the development side of it, and then look at what lessons we've learned and reflections around inequality, and then the jargon we have of the moment about build back better. How do we do that? I will address a few points for that. So first of all, just to start off in terms of when we think of where human rights are now currently sitting with a year to 16 months into the pandemic. In some respects, we're starting further back than before pandemic times. The impact of COVID-19 on persons with disabilities has had some universal truths when it comes to the rights of persons with disabilities. And CBM Global, who I work with, we work internationally, but these, truths are also with respect to the Irish experience as well. So I just wanted to speak a little to some research that was done during the pandemic. This was carried out by the Disability Rights Monitor, and it looked at kind of key areas where disabled people's lives were impacted by the pandemic. And this resulted in disruption of support services, leaving many persons with disabilities locked in their homes. And for those people without a family close by, this meant total isolation and having less support for carrying out daily tasks. It also had a complete failure to protect the lives of persons with disabilities in residential institutions. And I think we saw that also play out in Ireland in terms of access to nursing homes and the closed spaces where people with disabilities live and also other communities live. There was serious and multiple human rights violations against underrepresented populations of persons with disabilities. Women and girls have experienced a major uptick in gender-based violence. Children with disabilities have been denied access to online education due to accessibility. And homeless persons with disabilities have either been rounded up and detained or left completely to fend for themselves. And lastly, and I suppose the most concerning trend we saw in terms of a reversal of human rights was the denying of basic and emergency healthcare to persons with disabilities. And across the globe last year, there was a number of worrying reports about the adoption of discriminatory triage procedures. In some cases, persons with disabilities were denied access to treatment for COVID-19 because of their disability. So I think when we think about the year of constant change, this is, I suppose, stark reminders that the platitudes that we give to ourselves around progress, and sometimes progress has been made, when it comes down to the really fundamentals in terms of how we are structured as a society, and particularly with regard to persons with disabilities were left behind in all responses, and even in terms of building back better, as I'll speak to a bit later also on. So just in terms of reflecting from the development perspective, and last year we had the high-level political forum on the SDGs, and if we were to look back at the last 18 months, I suppose maybe some reflections about where we can say we are now as we come around to another UN meeting reflecting on SDG implementation, which will take place next month. We can say that while the goals are universal, and they were very universal in terms of their development, their implementation at country level has been severely impacted by the pandemic. The high-level political forum, which opened in 2020, had the sobering realization that the pandemic had risked reversing decades of progress in poverty and hunger, and places even greater obstacles on the way to for the implementation of the SDGs in many countries. Implementation of goals such as Goal 1, poverty reduction, Goal 3, health, Goal 5, gender equality, and Goal 8, inclusive, sustainable growth and decent work for all, and Goal 10 on inequalities between countries will require an extra emphasis to try and claim back some of the ground that has been achieved over the earlier years of the SDGs. And then from a disability inclusive perspective, each of these goals also remains critical for making gains in development. For example, country level research that we are launching today, which we've done in partnership with researchers with disabilities across 3 countries, highlight that health, livelihood, and gender equality remain critical areas to underpin disability rights within a development context. I suppose lastly, on the point of where we are now in terms of the year of change, In June 2020, I remember speaking with my team, kind of talking about the analogy of a boat. We're very far from land and without directions for safe passage on how to get back. And a year later, some of us are nearer to a sense of security, closer to shelter, closer to vaccine rollouts. And we're waiting to see if any of the positive changes that came through the pandemic, because there were some, and I'll speak to them in the Build Back Better piece. But overall, we're feeling safer from the immediate threats of COVID-19. But for the hundreds of millions of people living in the countries that we all work in, they are not as near to that safety and shelter that we feel. And the solidarity and collective approach that has underpinned international cooperation for the past 50 years is needed now more than ever. We morally and ethically cannot leave behind countries who are calling out for support with vaccines and other life-saving and economic socio supports. So in terms of what lessons that we've learned, I think the crisis has, shone a light on the lack of policy coherence in many aspects. And this is a critical area for us to think about. In terms of governments responding during the pandemic, looking at how to make sure that those who are most marginalized are part of the response and are included in the response and co-developing it is extremely critical. And from a disability perspective, the impact of discriminatory laws and policies have always been there. Ireland has ratified the CRPD, and many of the countries that we've ratified the CRPD, many of the countries we work in have ratified the CRPD. So therefore, the policy reform and the budget allocation that needs to come for inclusion needs to be part of Build Back Better. And just, I suppose, lastly, just to the third kind of the broader reflection around Build Back Better is we need to be more representative. And how do we make our systems more representative? Politics is failing to represent people who are most impacted by inequality, and as a result, people are disengaging. Persons with disabilities the world over remain outside the rooms of where decisions are made. And until this change happens for persons with disabilities and other groups, the systems that we work within will always be under pressure. Thank you.